Good afternoon, ladies and gentlemen. Thank you for joining us here, CAQH and Zane Networks. My name is Tyler Ford. I appreciate you spending a little bit of time this afternoon with us to talk through not only a topic, but a case study that CAQH and Zane Networks have received considerable interest in across 2023. Today, we'll be talking about a unique approach to Medicaid third-party liability and the identification of coverage for potential enrollees in Medicaid. Consistent with our mission and our vision for healthcare, CAQH is always looking for innovative approaches and data sets that can avoid healthcare waste and healthcare inaccuracy by bringing data, reliable data and services to the forefront of healthcare processes. And we're excited to share with you today one approach that CAQH has partnered with one Medicaid program, the District of Columbia, along with Zane Networks, to deliver a differentiated experience to identify TPL earlier in the process and to ultimately drive a better member experience. So we'll be going through a case study of what that solution and that experience has looked like today, along with what we feel are a differentiator in terms of what all Medicaid programs should be looking for in their financial accuracy efforts. Today, I'm joined by Jay Eisenstock of Zane Networks. We'll go through an introduction in just a second, but it's great to have you join us today. I'm actually going to turn it over to Jay to introduce himself first, and then we'll dive into a little bit more of the content. Jay, do you mind introducing yourself?
Great, thanks, Tyler. Welcome, everyone. We're excited to talk with you this afternoon and hopefully give you some sense of an approach that might be unique to doing TPL recovery. I've been involved in healthcare and IT for a number of years, working both from a health plan perspective, from a provider perspective, and from a vendor perspective. And I serve as the program manager for this effort at Zane Networks for this particular project that we're going to be talking about this afternoon, or this morning if you're on the West Coast.
That's great. And my name's Tyler Ford. I serve as the Vice President of Strategy and Partnerships for CAQH. We'll go into both a little bit more background on CAQH and Zane Networks in just a moment, but I have spent the majority of my career, much like Jay, at the intersection of plans, providers, and vendor services. Spent some earlier time in my career at United Health Group and Optum. And here at CAQH, I am laser focused on trying to identify leading strategies, new data solutions that can drive value consistent with our mission to try and take cost out of the system and connect healthcare organizations. Just a quick note, as we get into the presentation, wanted to share just a few housekeeping items. First of all, this presentation is being recorded. We'll make the recording and the slides available for folks asynchronously after the presentation. We have made all of the attendees on this webinar muted. So if you have a question, there's actually a function in the GoToWebinar user interface where you can enter a question, and Jay and I will look at those throughout the presentation and then hit some of those toward the end. So if you have a question, please use the chat function for Jay or I, and we will not be able to kind of accept those as we go along. But as we go through, I first wanted to take a little bit of time just to introduce the audience to the two organizations that Jay and I represent and that have been leading the work around the District of Columbia's Medicaid program. Jay, can you first introduce and share a little bit more about the mission and the work that Zane Networks does in healthcare?
Sure. So Zane Networks has been in business for over 20 years, located in the District of Columbia. It's a minority-owned small business, and you can see the designations there in the lower right-hand corner. Zane's focus is on healthcare transformation services for a lot of government entities, specifically working on government grants, looking at local and state entities, services that include everything from telemedicine to specialized web development and so on and so forth. So very much entrenched within the healthcare environment, working with a variety of, like I said, government clients and some commercial as well.
Excellent. And I also wanted to take a moment to introduce the audience to CAQH. If you're not familiar, CAQH is actually an organization that is collectively owned and operated by some of the largest health plans in the United States. We've existed for about 2 decades with the mission of streamlining the business of healthcare by connecting and sharing and standardizing the information that flows between payers, providers, and other organizations. Our primary sponsors sit in the middle of the circle on the page, and we take pride not only in our place delivering data solutions to healthcare organizations, but it is particularly special because of our scale and our penetration. There's 2 parts to what CAQH does. Part 1 is a provider data solutions enterprise that connects and provides standards around provider professional information sharing. And to date, we have actually created a platform that facilitates the movement of information from about 2.5 million providers to about 1,000 different health plans. We are also privileged to work with the health coverage information from well over 50 different payer organizations with the goal of increasing the accuracy of claims payments and eligibility services. And the focus of today that we'll talk through is that data utility that we've put together to help health plans, state Medicaid agencies, and other organizations coordinate benefits and determine eligibility and obligation for members with a comprehensive data set that is validated and reliable. All of this and all of the kind of mission of CAQH is meant to connect the healthcare industry, facilitate interoperability, and ultimately provide a more connected and less costly experience for everyone. And with the backdrop on those 2 organizations, getting my slides set up here, we actually wanted to introduce the third party in this case study, the District of Columbia's Department of Healthcare Finance. And I think Jay is in unique position to kind of describe a little bit more about not only the District of Columbia, but how Zane Networks began a transformation initiative with the Medicaid program for the district several years ago. So Jay, if you don't mind setting that context for the audience, I'd love to turn it over to you.
Sure, thanks, Tyler. So yeah, just a little bit of background on the Department of Healthcare Finance. This may not be a unique structure, and some of your organizations may function this way as well, but the Department of Healthcare Finance is the entity within the DC government that is responsible for Medicaid services. They also administer programs for immigrant children and the SCHIP and CHIP services as well. There are about 300 some odd thousand Medicaid enrollees last time we checked the numbers, which is in the spring. A population of about 679,000 residents within DC. So that's the context of that we're looking at in terms of what is the market that we're addressing here with our solution.
Absolutely. And Jay, I wonder if you could talk through a little bit more about the eligibility and third-party liability program that the District of Columbia had along with its ambition.
Yeah, so I guess about 4 years ago, probably closer to 5 at this point, DHCF, sorry, sometimes I get the letters confused, decided that they wanted to take a different and more unique approach to Medicaid recovery process, and that is to separate out TPL from recovery and keep it as a separate offering, and actually did an RFP in order to allow that vision to happen. And the idea was to maximize the savings of the TPL recovery process by breaking the 2 pieces out. And so Zane competed for that work and was awarded the contract. And so the idea behind this was to, as I just said, maximize the TPL identifications, but also cleanse the current database, which had been in existence for quite some time and had a lot of outdated coverage. And the idea here was to bring that coverage up to date for the Medicaid enrollees within the system. And, again, not, I'm sure, a surprise to anyone on this call, but, the real goal here was to improve care coordination and reduce out-of-pocket costs for beneficiaries by making this a more efficient and robust process.
Absolutely. And Jay, I appreciate not only that overview of what the District of Columbia was trying to accomplish along with Zane Networks. What I really want to underscore is that CAQH has the opportunity to engage with a number of different stakeholders, talk to health plans, Medicaid agencies, organizations that serve patients all over the United States. And really what this was this need in this program was part of a broader trend, I think, of trying to bring increasing focus to the front end of the payment process to try and bring as much intervention into the early stage of a payment process as possible in order to try and avoid what downstream inaccuracy can result in significant waste in terms of recovery. And so I was eager to partner together with Jay. We were eager to partner together on this initiative to try and understand the more cost avoidance that can be driven, the more efficient the experience is, not only for the sponsor in the program, but ultimately it is right answer to try and drive payment accuracy as early as possible for provider reimbursement and then for the experience of members as they seek care and enrollees. It's part of a broader trend that we saw kind of out in the market. I wonder, Jay, if you'd be willing to talk to the team a little bit about the solution that you developed and the vision for the District of Columbia.
Yeah, so a little bit of history here. So as I mentioned, Zane Networks won the bid in order to provide TPL services for the district, and Zane was the primary contractor on the bid, and we had a subcontractor, a technology vendor, and the idea was that technology vendor was going to essentially provide all the back-end systems in order to identify TPL for the Medicaid program. When we set it up, it was a pretty clean vision. Zane's role was going to be, frankly, fairly limited initially. The bulk of the technology is going to be through this other vendor. But as things happen, and probably wouldn't be here talking to you if this hadn't happened, actually, that vendor was not able to provide the quantity and quality of TPL coverage that we were looking for, what the district was looking for. So we had to do a change correction. Fortunately, Zane is a small and nimble entity with a lot of talented people. So we came to a crossroads, and the decision was, do we look for another technology partner, or do we build our own TPL offering from the ground up and build something that could be replicated and used in other Medicaid programs, and frankly in some commercial programs as well. So we took the second approach. So we limped along for quite a while, and literally in less than a year we had a new system up and running from the ground up, where we're able to really expand the opportunity, working with CAQH as our primary data source. We also have 3 additional data sources that we've connected, and actually looking to bring on another one early 2024. So to me, it's a good example of lessons learned and how you kind of take, make lemonade from lemons, to brutalize that expression. But it's been a great opportunity, and I think the results have really shown that we've been able to make this work and really have done an incredible amount in terms of getting high quality, accurate TPL results back to the district on a regular basis, driven by, as I said, that primary connection to CAQH.
I appreciate that, Jay. And I wanted to take just a moment to describe a little bit more about that foundational data source that Jay talked about in terms of identifying TPL opportunity. CAQH has been working for the better part of a decade to put together what we feel is one of the national sources of patient coverage in America. CAQH's Coordination of Benefits Utility is a national database that over 55 different health plans, third-party administrators, and state governments take advantage of. It is a participatory data source wherein once weekly, individual participating plans submit into CAQH a standard set of validated member coverage files that are aggregated together, normalized, and then validated through CAQH to try and put together an accurate view on what are the sources of coverage attributable to each individual and their family. And today we've got really significant participation. 100% of national health plans participate in this source and contribute in nearly every line of business. And what that has yielded is actually a coverage database of about 245 million Americans refreshed weekly with multiple coverages wherever they're identified. We then validate all of that information when we discover multiple coverages per an individual through a real-time 270 transaction out to those payers that validates the primacy of which coverage he or she is eligible for. And ultimately, what this data source does then is provide a really robust, constantly refreshed and validated source of information to understand what health plans are attributable to information to individuals. And so this data utility, although today it is heavily used by commercial, Medicaid, and Medicare Advantage participants, increasingly we have been working with not only kind of state Medicaid representatives, but ultimately anyone who seeks to ultimately drive toward payment accuracy by tapping into more reliable information. We are increasingly looking for new ways, new customers, new use cases where information like this can be valid. So as Jay had kind of talked through the solution that Zane Networks devised, this data set was the crux of what could be used to identify or come up with those TPL opportunities. And Jay, I know you're going to hit every single box and every single flow on this line, but I thought you could talk a little bit to the audience about the underlying architecture and some of the setup of the solution as it shows up for the District of Columbia.
Yeah, I'm certainly not going to do that, but I also wanted to just talk about one thing. Several folks have come up to me. In fact, we gave this presentation at the MESC conference over the summer, and people are asking me, well, rather than go through CAQH, could you have gone directly to the health plans? And especially if you look at the District of Columbia, and probably not unlike your markets too, there's probably a very small handful of carriers, commercial carriers, that would cover the vast majority of the population potentially for TPL. And frankly, we did start out in that doing that approach. I did reach out to some of the larger carriers in the area about doing direct connection. But then as we started having conversations with CAQH, I realized a couple of things. One connection, especially as robust as CAQH is, as Tyler explained, was worth quite a lot as opposed to connecting with multiple sources in one market. And second of all, as I know most people are aware, just because someone lives within the district, they may be working for an employer, and their coverage may be from a plan that is, somewhere else. So the ability to be able to do this nationally and make it scalable was, preeminent in terms of making that decision to go with, a limited number of high-powered connections. So I alluded to this earlier that, because we built from the ground up, we had the ability to use, advanced architecture. We can expose APIs. We can bring on new connections, pretty rapidly. The process is, because it's a modern, built on, a robust architecture, it allows us to scale very easily. Right now, it works in a Microsoft Azure environment using SQL Server as the database backend. And since I'm not the technical architect, that's probably as deep as I'll go. But wanted to show you this because I think it gives a sense of how involved and how large this platform is at this point.
Yeah. And I only wanted to echo what Jay had mentioned before. We've had the opportunity and the privilege to talk to a number of different Medicaid operations administrators and technical leaders. And time again, what we hear is that the proliferation of individual connections to payers can become overwhelming. And that challenge is actually becoming greater as individuals across the United States have more diverse, spread out employers, as their coverage could move quite frequently. And so the elegance of an ability to tap into one data set and one connection like a CAQH versus others was one of the advantages of the system. The other component was Jay had actually mentioned earlier the fact that Zane Networks, being a smaller organization that can move nimbly, that really has struck a chord and been a differentiator to try and respond to certain customization that is unique to every program. And so one of the real features and one of the real benefits of this model has been the responsiveness that Zane Networks has been able to bring to what can be a very complicated set of connections throughout all of the Medicaid operating system. Jay, I wonder if you might talk to the group a little bit more about the transparency and the reporting that gets delivered to the district.
Yeah, so as most people are probably aware, I mean, a lot of this is a black box, right? It kind of works in the background and you don't really see what's happening. So I'll try to give a little bit of some, color commentary to this. So the district is a monthly process. I know different Medicaid organizations may do it more frequently, but essentially what happens is the district delivers, well, actually the MMIS vendor delivers to us the TPL file monthly, and we identify the TPL through that automation, as I said, to the various carriers through CAQH and a few other connections. We also have the ability to do manual outreach to carriers, although our mission is to try to avoid that as much as possible. We do have an auditing process that we also do that is a combination, again, of manual and automation. What I depict here in the middle, which I know is hard to see, but just a screen, one of the several screens that we have for our auditing staff where they can go through and review, and the system will either randomly pick for them particular records to review, or they could do it by carrier, and they then will go in and manually call the carriers to verify the information. So we've got those tools in place. And then the last part is a dashboard, again, just showing pieces of this. And the dashboard is flexible. We can modify it for any particular need that a Medicaid or a commercial plan may have. But just showing, the trends, the amount of medical versus pharmacy or dental, that's always good information to have. And, how the trends have been over time. Through 2023 has been an interesting year because of redetermination rather. So you see some ups and downs in that. So some of that information has been interesting to be able to provide at a glance.
And I wondered, Jay, if you could talk to what have some of the outputs or the results been that your team has seen in working together with the district?
Yeah, so as we've been talking about, maximizing that cost avoidance by, increasing, a growing number of commercial carriers that we've been able to identify. And, the one in the middle, identifying terminated TPL, I said at the very onset today that was one of the goals that the district had is to clean that database. We've had instances where there's been records on there that are 2, 3, 4. Actually, just this week, I got a call from them. They found a record that was 8 years old. And so, the ability to go in there and, cleanse it with more up-to-date information about that beneficiary is really important. And then again, the way this model works, the way the contract works is Zane is paid only for verified TPL. So we are incentivized to ensure that we provide accurate and quality number of verified TPL records to actually get paid.
And so as we pulled up, we wanted to kind of think through what were the learnings, or across the experience that the district had, what were some of the things that made that unique? And what were some of the principles that we'd encourage anyone who works in the Medicaid space or in TPL identification to try and think through as the success ingredients for this partnership? The first that we wanted to stress was this idea of data quality and the real focus on upfront identification versus the reliance on the recovery process. Not only having rich, refreshed, and expansive data to try and identify opportunities, but really being able to rely on validated information at scale. That was something that really was a linchpin of what helps the district not only take full advantage of the identification that Zane is able to drive, but individually the solutions, and trying to make sure that that solution and the data sets are elegant, and that they are not kind of bogged down by multiple connections. That was a real success factor. Part two, and Jay had kind of walked through some of the transparency in terms of the reporting and the dashboards, but the ability to work collaboratively with the client, with the district, to be able to frequently show progress and show what the volume of opportunity was, that went a long way in terms of driving for long-term trust between not only Zane Network, CAQH, and the district, but it created a sense of accountability as well. Really not being able to rely on just the reporting that was coming from the vendor, but to be able to show through dashboards, through a focus on real-time ability to kind of check on progress. That was critical. And then the third part that we wanted to highlight was the uniqueness of the model of trying to separate out identification from recovery and tying an accountable business model to the fee structure for everyone involved. We really think that that third-party objective lens through which CAQH provides information, and that Zane Network approached its relationship with the District of Columbia, started to avoid competitive issues or perverse incentives that may occur. And it was the hallmark of trying to separate out the effort on identification from recovery that was the basis of that and the crux of that. When you put these three things together, we think that differentiated model has created a lot of success. And we really think that there is an opportunity to replicate and scale some of the principles that have emerged from this relationship out into other places in the country. And so what Jay and I are eager to do, if you or your organization works in this space, if you're working with a Medicaid program and you ever want to learn more, we are 100% committed to the idea of sharing best practice and insight out into the community around what the experience has been. And with that, we would love to kind of pause, stop talking at you for a second, and we'll take a look at whether or not there's any questions out there. If you have any questions, we're happy to take them in the chat right now. And if we don't have those, we will wrap. Give it one more minute. Jay, anything else that you might say just in closing from Zane or from the experience while we see if there's any questions?
Yeah, I think another aspect of what you just talked about in terms of, the ability to make this a more robust process for everyone is, data analytics and, looking at things such as, you can look at demographics to see, the nature of the population that has, commercial coverage. There's a lot of deep dive that you can do with that kind of data. We've done analysis like, as you mentioned, redetermination before, how long before someone, is on Medicaid, and then they have commercial coverage. There's all kinds of things that you can do with the data that can be helpful from a planning and analysis perspective. And I think that the more robust the data, the better the information you'll have, and I think not only goes to cost savings, but certainly inefficiencies, certainly efficiencies in running these various programs.
Well, that's fantastic. I wanted to say thank you, Jay, for joining us today for this webinar to kind of go over the fantastic work that your team has been able to achieve in partnership with the district. But I also wanted to say thank you to our audience and the CAQH team for leading this opportunity to walk through this case study. Jay and I both have our contact information available here. We're easily accessible through LinkedIn or through other channels. And wanted to say thank you to the audience for a wonderful discussion and an overview of the case study. With that, we're all set.
Thank you all as well for attending today. Hopefully we were able to impart some interesting information to you all, and thank you, Tyler and CAQH, for inviting me.
Absolutely. Thank you so much. Bye-bye.
Bye all.